Within any given BMI category, including the normal BMI range, individuals with higher body fat percentage or greater central body fat have a higher risk of cardiovascular disease than those with lower body fat levels. Relying on BMI alone can therefore lead to significant misclassification of cardiovascular risk. Hello, I am Dr. Vivek Prasad, an obesity medicine specialist, and at University College London I work on studying the association between DEXA measured body fatness and chronic diseases. I am pleased to share that our article titled Association of Body Fatness with Hypertension, Dyslipidemia and Myocardial Infarction in a Multinational Pool Cohort will appear in Mayo Clinic Proceedings. In our pooled multinational analysis of over 56,000 adults aged 40 years and older, higher levels of DEXA measured body fatness, whether expressed as total body fat percentage or trunk fat mass index, were associated with increased risks of hypertension and dyslipidemia across BMI categories, including among individuals classified as normal weight. The pattern for myocardial infarction did not mirror those for hypertension and dyslipidemia. Increases in trunk fat were linked to higher MI risk only among men across BMI groups, with no clear pattern observed in women. Overall, these findings highlight that relying solely on BMI can obscure substantial cardiometabolic risk, and that direct measure of body fatness provide more sensitive and clinical informative indicators of cardiovascular disease susceptibility. These findings indicate that clinicians should look beyond BMI when assessing cardiovascular risk. Incorporating direct measure of body fat percentage and fat distribution can improve risk stratification and help identify individuals who might otherwise be considered low risk based solely on BMI, and also mislabeling those with healthier fat profiles as high risk simply due to BMI. Patients with normal BMI may still have unhealthy levels of body fat that elevate the risk of blood pressure and abnormal cholesterol. This underscores the value of personalized assessment of body composition and targeted lifestyle or preventive interventions even when weight appears normal. Similarly, some patients with high BMI may have healthier pattern of body fatness and therefore lower cardiovascular risk. Our next step is to conduct longitudinal research to examine how changes in total and central body fat over time influence cardiovascular events and mortality. This work will help clarify causal pathways and inform the development of clinical thresholds for unhealthy body composition, as well as public health guidelines that incorporate direct measures of body fatness rather than relying on BMI alone. Thank you for your time, and for more detailed information, please refer to the full article.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.